So when I talk to people about birth, often what comes up is people's fears around birth. And one of those fears that is common through a lot of different conversations is the fear of tearing. And so in terms of tears, there's 4 different degrees. There's 1st degree, 2nd degree, 3rd degree, and 4th degree. And all the way up to 3rd degree, tearing often can heal without sutures. There's also other different types of injuries, including lacerations that you may encounter in birth, and all of these things that I'm going to share in this video hopefully will be applicable to reducing all those kinds of injuries. So in terms of factors, risk factors for tearing, some of the relevant ones that I wanted to bring up are the following: being a first-time mom, being an older woman, having lower or reduced elasticity of the skin, being an athlete with a really strong and unyielding perineum, having scar tissue from a previous episiotomy or tear, your nutrition status, your hydration status, control issues, which is more of a psychological factor, but having trouble letting go, as well as having a hospital birth with managed care. And so this can include Pitocin, epidural, induction, forceps, vacuum, all those kinds of things which disconnect the mom from her natural instincts and urges and makes it more difficult for her to birth without tearing. And something I wanted to share is that your choice of caregiver is really relevant to this conversation of how to prevent tearing. So OBs, obstetricians in large urban areas, tend to have the highest rates of perineal tears and traumas, whereas midwives in or out of the hospital maintain some of the lowest rates. And I'm not going to fully cover episiotomies in this video because that's a whole other big conversation. But in assessing the benefit of them in relation to preventing tears, it may be beneficial to know that a tear, a natural tear, is far less likely to go into the muscle than an episiotomy, which always cuts into the muscle. And cutting into the muscle inherently weakens it, which increases the chances that it'll tear further. So imagine like a piece of paper or a piece of fabric, and if you cut into it and pull or put tension on it, it's far more likely to rip more dramatically than if you were just pulling on it and putting tension on it with no cut in it. Another thing to know is that the strongest postpartum pelvic floors are those that remain intact. So it really is beneficial to reduce the incidence of episiotomy or tearing when at all possible. And another thing is that tears through the anal sphincter almost never happen without an episiotomy occurring first. It also can increase risk and incidence of other gynecological issues later in life, as well as pelvic or perineal from a pelvic or perineal trauma like an episiotomy. And then I guess we would want to go to prevention. So how do we prevent tears if they're not super ideal? So one of the main factors, which goes back to choice of caregiver, is having increased parental responsibility, and by choosing a caregiver that aligns with your beliefs and wishes for your labor. The greatest risk factor, some have said, to your risk of tearing is your choice of caregiver. And so it really is important to choose someone who understands what you want and will support you in a way that will lower your risk of tearing. So this includes supporting your instinctual responses around your birth. It also is beneficial to ask your caregiver potentially about their stats related to episiotomy and tearing, and that will give you kind of a picture of how they manage a labor and when and how often they will step in and use an episiotomy. Another thing that's related to caregiver is having continuity of care can be really helpful. So the more you know and trust and have a relationship with your caregiver, the more you can relax, which is really one of the key things of reducing tearing. It's important to take care of yourself as a mom who's about to have her baby, to maintain your nutrition and hydration and sleep and manage your stress, all of those good things. Your flexibility as well is important, to keep moving and agile as much as possible. It can also be beneficial to learn to relax your pelvic muscles, as a lot of us tend to clench and also sit in a way that doesn't really support our pelvic muscles very well. So if you can learn how to intentionally relax them, that can go a long way to helping you in your labor be able to relax and really allow those muscles to stretch to accommodate for the baby. Another thing is a feeling of safety. This also promotes relaxation, and as well as warmth can be really helpful. Staying hydrated, I mentioned. And then another thing is to follow the labor and keep hands off as much as possible. So touch stimulates muscles to contract. And so if we're having people touching or feeling around our vulvas or vaginas when we're trying to have a baby, it really is counterintuitive to that opening and relaxing you want to have happen, as it can make us clench up and really add tension to the areas that we want to be relaxing. Another thing is squatting. Squatting can be really helpful in your pregnancy, or just generally in life. If you are planning to get pregnant, some give a little bit of a caveat that if you are already late in your pregnancy and you haven't really been doing any deep squatting with your feet flat on the floor before, it can cause your baby to drop really low in the pelvis and have a much harder time turning into the correct position for labor. So that's maybe something to be aware of, depending on where you are in your pregnancy, if you want to utilize that or not. Another thing is positioning. So upright can be really beneficial. However, sometimes being vertical can expedite the labor to a point where the baby comes very quickly, which can also increase tears and kind of work a little bit counterintuitively to what we're trying to achieve. Your legs should be no more than comfortably apart. So if you really feel like things are stretching, that may be an indicator that have your legs further apart than is ideal for preventing tears. You can change positions as desired. You can avoid desensitizers like epidurals or other forms of anesthetic that don't allow you to feel the sensations of birth. When you are feeling them, you can really help to slow things down, allow your tissues to stretch and to not push against them, the contractions, which help you to bring out the baby. Another thing is water birth can be really helpful. The water can help to relax and soften the tissues, as well as the warmth can be really helpful for relaxation. You can also use controlled breathing, and you can ask your support people to help you in this area, to look up some different techniques and to have them be aware of them and be ready to help you in that way as well. It's also important to note that not all contractions are the same strength, and they tend to kind of come in waves. So sometimes you'll have a small one, and then a big one. And you can really work with that, and you don't have to have each contraction being as strong as the next. And you don't have to work harder than the contraction to really bring out the baby if what you're getting is a smaller contraction. And I just wanted to end off with this quote from Michel Audin, who's a doctor. And he said that a fetus ejection reflex is usually associated with a bending forward posture. When a woman is bending, the mechanism of opening the vulva is different from what it is in other positions, and the risk of dangerous tears is eliminated. So really that upright forward bending posture can be really helpful in reducing tears compared to that semi-sitting, reclined, lying back position that we really commonly see today in birth. So I think that's all that I have to share for right now on prevention of tears, but I was thinking I might also do a video on healing tears naturally and besides suturing, as well as maybe a video on episiotomies if people think that might be interesting. So yeah, stay tuned for that potentially, and thank you for watching as always, and I'll see you next time.